Um, Good afternoon, everybody, and thank you once again for joining us with what is now our 12th UCD COVID seminar series, co-hosted by my colleague, Dr. Blona Gavin, Mr. Paul Harkin from UCD, and also the College of Psychiatry in Ireland. I'm facilitating this from the lovely sunny west of Ireland, if I can attract you all to a staycation here in the west. But our presenter is actually coming from an even nicer and sunnier climate, that of Stanford in California. So I'm delighted to introduce Lawrence, Professor Fung, who is a professor in psychiatry at Stanford School of Medicine, and who's also the director of the Neurodiversity Program. Laurence has been passionate both as a psychiatrist and as a father of a young teenager with neurodiversity, which I'm sure Laurence will explain a little bit more, in really being very, very innovative and developing a strengths-based approach to both university students, facilitating optimizing their potential, and indeed increasing innovation and output in society at large, but also by way of providing additional information and training to those in the corporate section. And obviously Silicon Valley is a fantastic place to start that, and by contributing to clinical services in the way of neurodiversity. Myself and Blona have been working with Laurence for over a year and have been very excited about our collaboration together, and we are delighted that the School of Medicine and UCD have been very, very supportive in UCD also taking on board the Neurodiversity Program. And colleagues Beth Kilkenny and Tom Flanagan from the Quality, Diversity, Inclusion Group are also joining us today on the webinar. So we look forward to that development over the period of time, and we're very grateful to you, Laurence, for that. In terms of, just by way of other news, that Timothy Frawley from the School of Nursing in Blonid have just had the confirmation that the professional certificate in neurodiversity will be commencing in UCD in January 2021. So without further ado, everybody is probably familiar with the format now. Laurence will speak for 45 minutes, and then we'll have a Q&A session at the end. So Laurence, over to you, and thank you very much.
Thank you so much, Fiona, for the kind introduction and this nice invitation. I wish I can be over on your end, closer in person, but we're all dealing with the COVID altogether. So today I'll be talking about neurodiversity and the impact of COVID-19. So I'll give you a little bit of an introduction of what neurodiversity is for those that are new to this term, and some of what COVID-19 has been causing to the neurodiverse population. And I'll talk about some specifically the psychological impact to the families and individuals on the spectrum, and some strategies to cope with the anxiety for neurodiverse children as well as adults. And then the last part, I will be talking about how our Stanford Neurodiversity Project is combating COVID-19. So what is neurodiversity? Neurodiversity in our organization is defined as a concept that regards individuals with differences in brain function and behavior as part of normal variation in the human population. So when we talk about neurodiverse conditions, oftentimes we'll consider conditions such as autism, dyslexia, and ADHD. And as you can see, I have to update this. It should be 1.9% now in the United States, and is shown not only in the pediatric population, but also in the adult population. But when we talk about neurodiverse conditions, we would also consider dyslexia as well as ADHD as part of the neurodiverse conditions, and perhaps others such as Tourette's or even epilepsy. Those are all kind of under the neurodiverse conditions umbrella. However, as a specialist in autism, a lot of the time I think about autism as the one that I would want to solve problems for. And as Fiona said, I have a 16-year-old teenager on the spectrum, and a lot of what he's doing, he's telling me, really affect how I view what autism is. So after COVID-19 started, the world has changed. Now we are practicing social distancing. Is really about physical distancing. We want to stress that this is social distancing. It does not mean social isolation, but a lot of the time, isolation is inevitable just because of what we are supposed to do, and in what different countries are allowing their citizens to do. And definitely disruption in work, school, everyday activities. This is all really impacting a lot of people. So if we think about the mental health impact by COVID, there are a couple of examples that I'm going to give. This example is coming from China in two different cities, Guangxi and Wuhan. And these are children from the 2nd grade to 6th grade. And this data is coming out from between, basically, these children are in a lockdown from end of January to end of March. And it is around end of March that the survey is given to these children. So these are all neurotypical children, and they have been in confinement for about 2 months. And what they are saying after 2 months is that, remember, these are all neurotypical children, and 2/3 of them are actually quite worried. Are worried. 1/3 would be considered quite worried, and 1/4 moderately worried. So about 1/3, they are pretty much not worried. And how about the level of optimism? Actually, the children, by and large, they're quite optimistic about the world. So despite that, there's a 2-month really unusual lockdown that prevent them from going anywhere. In China, it's pretty much very tight in what how they practice law, as you may imagine. So so despite all that really drastic measures, almost all people are actually optimistic. Only 2% are not optimistic. And among these neurotypical, it's a mix of children, basically, but most of these children are considered as neurotypical. There are no depressive symptoms after 2 months, but 23% has depressive symptoms after 2 months. And similar number, 19% has anxiety symptoms. So that was in China, in the environment that's complete lockdown for 2 months. And there's another study in the United States. And basically, this is in the beginning of the shelter in place in our country. So it's only like a couple of weeks from or so after the start. And the survey was sent to 70,000 families and getting 8,000 families to respond. And the participants mainly that are responding are moms and their children. And this is the breakdown of the percent response or percent total response from different parts of the United States. And what we see is that 63% of the families are reporting that there is severe disruptions. And that's only just about a week or two after the start. So, so this has to be put into context because right now we're in August now. So you can only imagine that there's many more that would be experiencing severe disruptions. And 64% of the family report that speech therapy is most disrupted. And when we look at the families reporting the kind of setting that have been disrupted, school, there was only 84%. I think now almost is going to be close to 95% in this country. Sorry. So going to clinic is disrupted. The home services are disrupted. Daycare disrupted. Residential programs are disrupted. And I have to say that this number is really is important, but is not really reflecting the gravity of the issue because the lack of daycare services is actually a huge problem for many people. And in terms of remote services and therapies, in March, basically 35% of family are receiving remote services, and 43% are benefiting moderately well to significantly from these services. 62% of these families report that their child with autism is feeling good overall. So that's only like a week or two. So, I mean, right now with many months now, I can only imagine, well, I don't really have the numbers because I don't have the numbers, but basically practically all of my patients on the spectrum, they are affected, and I would say probably like about one half of my patients would say they feel very much impacted. I think partially for kids with autism or adults with autism, there are some that are actually completely comfortable staying at home, but there are some that are really needing the routine that they usually need to walk to the park or going to school to do what they need to do. And when that structure is disrupted, is actually quite devastating for them. And in terms of the parent or guardian's mental health, about one half of the parents and guardians are feeling good overall. That means the other half is not feeling good. So what I would recommend for parents to consider is to help the children to make sure that they have good structure, even though it is a new structure. And definitely it is going to be something that would be feasible. If the structure is not feasible, it won't last long. And for younger children, especially, social stories would be helpful to explain why they need to stay at home, why they need to wash their hands a lot, why they need to put their mask on, and so forth. Pursuing hobbies, when you're in lockdown, if you can actually find something fun to do, maybe it's a new thing. It may be something that can get our children to be able to be entertained, and they may even learn something new. It's important for not only the children, but for all of us to make sure that there's rest and relaxation. The other day we got some data and say after the pandemic has started in the United States, on average, the people that are working, they work 48 minutes longer. So that every day, so that means that the boundary between work and home is blurred, and a lot of people are really relaxing less. So the next thing is to consider having the children to help out with cooking. This is something that could be getting them involved in something maybe fun for them. And it's a good bonding experience, and it may also teach them some independent living skills. And enjoying time with family as much as possible, and a lot of the time it may be virtual, but the social distancing does not mean really social isolation, as I mentioned. We really need to be connected with others, and it's really wonderful that having Zoom and Skype and all that is really making it possible for us to be connected with the people we care about and the people that can support you, and you may want to support them in return. And lastly, for children, well, actually not lastly, I still have some slides for child, and then I have some slides for the adults. So telehealth appointments. In our clinic, actually, our basically volume for seeing patients have not decreased, because people just shift to telehealth very readily. And if children really need to be seen, they can be seen without any problem. Even the COVID is affecting many other things. So maintaining contact with school is really important. Recording the children's progress, if there's regression, it's important to document all that so that they can be shown to the school teachers, the special ed case manager, etc. Because sometimes they may not know the gravity of the problem. Maybe they would minimize the issue if they don't remember that the child is at a particular level. So if there is recording to show that there is regression, then that's evidence to support that they would need certain kind of support from the school. So what about adults? So adults on the spectrum also face social isolation. A lot of the time this is something that can be really made worse and worse if you don't do anything about it. So we need to know about it and try to fix it. Duration of shelter in place can be a big problem. Uncertainties about fears of infection, the frustration and boredom. Sometimes some families do have inadequate food supply. And fake news, inaccurate information can be very confusing for all of us, but especially for people on the spectrum. And challenges to work while taking care of family for those that have children. That's a really big one. And that can affect job instability, job stability, and it can also affect financial stability. So finally, the stigma. Some of us will get some unnecessary comments if we are going outside, and this is all adding up to be a lot of stresses, and especially for people that do not know how to manage their anxiety and stress, it can be a really big problem. So learning about ways that can manage the stress, anxiety in a personalized way is helpful, because there's no one way, no one size fit all solution that we can give to our patients. Some of them will work with new routines. Some of them you can teach them about relaxation. And some, for all of us, we would need to know self-care is important for us to make sure that we eat a healthy diet, we have good sleep hygiene, we want to make sure that the physical activity is maintained. So for some people, if we don't really try to get ourselves to have a clear mind, we can make wrong decisions. So preparing our patients to solve problems with a clear mind is a potential strategy. And for it's not only for parents, but for all adults, and maybe even for children, in this really difficult time in our world, accepting imperfections is probably a reasonable strategy, because we are all really trying to figure out how things are how things are evolved. And if we are not able to accept imperfection, we are going to be feeling defeated all the time. And over time, that way, depression can really emerge. So knowing that it is actually okay to be imperfect in this particular time is actually an important strategy. Telehealth appointments for adults, just like the kids. And the last part, I'll talk about what we do in our Stanford Neurodiversity Project to combat COVID-19. So this is a project that was started in in 2017, really officially is 2018 as a special initiative of the Psychiatry department. And what we are doing, there are 4 tenets to this project. First is education. We want to educate the general public as well as the neurodiverse population. We collaborate with the various departments at Stanford, as well as other service organizations and corporations for employment opportunities and mental health support. We also do advocacy work, and especially this time around during the pandemic, I'll tell you about what we are trying to start doing. And we collaborate with many different groups on that. And in order to make sure that our work is indeed effective, we do research, and we hope that we can disseminate the research. So one thing that we like to think about is a more eco system model of neurodiversity. So for a neurodiverse individual, there are many layers of support. First, you have the families and friends, you have your mentors and therapists sometimes, and a bigger circle could be the teachers, coaches, classmates, roommates. Those are important people in the educational setting. And the larger picture is the school officials and the school community that are going to be able to change the culture of the educational setting. And similarly, in the employment setting, we have supervisors, job coaches, colleagues, as well as executives and work community as a whole can change the culture of the employment setting. And also some other supporting communities as well. So basically, when we are thinking about support for neurodiverse individuals using the strength-based model, we are really trying to figure out at various layers of this ecosystem what we can encourage or recommend to the stakeholders to do. It is really the most important thing in this project that we try to make culture change. Without having culture change, helping the neurodiverse individual alone as a strategy will not be really self-sustaining. So we have various initiatives. The first initiative is Neurodiversity Awareness and Education Initiative. The second is Neurodiversity at Work and Wellness Initiative. And the third is Independent Living Skills Initiative. Within the first initiative, we have this special interest group for neurodiversity. Basically, we meet once a month. We have been doing it for 3 years now, and every month we invite someone knowledgeable on some aspect of neurodiversity to come to us. In the past physically, and sometimes they Zoom in from far places, and basically we have an audience to be benefiting from the wisdom that the speaker would share with us. And usually the topics that we talk about are related to employment, specialized support in college setting, as well as mental health support. The Neurodiversity Awareness Program, basically that's mainly me talking about neurodiversity at various different places around the country and around the world. Like today is basically my effort to be telling you about what we are doing. And I also teach neurodiversity courses. There are 2 courses. One is a year-long seminar course on neurodiversity, and second one is a design thinking course. And actually, after this presentation today, later on I will have a workshop series, and I'll tell you a little bit more about that. So Neurodiverse Student Support Program, this was launched last year to support our neurodiverse students at Stanford. And we have all sorts of support from peer mentoring, that can help with independent living skills, social skills, transitioning to college. And we also help them with getting accommodations, some learning support with some collaboration with our colleagues in other organizations on campus. And we also encourage them to take the year-long neurodiversity course that I talked about. And the high school camp, we launched this last year as well. And this year we had attracted over, I think it's about 350 students to come to a 2-week virtual camp. And we had to select 40 students because we it is very interactive camp, and we cannot take 300 students. So so this was completed only last week. It's a really cool 2-week experience. We also had some teachers joining us in the beginning and the end of the camp to teach the teachers about neurodiversity and the advocacy around neurodiversity. We also have this full-blown project, Neurodiversity at Work program. Is a specialized employment program that's funded by Autism Speaks, which is the largest nonprofit organization supporting autism in the United States. And in this program, we provide specialized employment support, not only for the neurodiverse individuals, but also for the employers, and not only for getting a job or matching people to positions. We also provide support, ongoing support during the transition time after onboarding. And I also direct the Adult Neurodevelopment Clinic. So we focus, the last bit of the presentation, I'll talk about some of the things that we do currently, and I would focus on employment. And basically 70 to 90% of adults on the spectrum are unemployed or underemployed. And this is really a huge problem before the pandemic. And after the pandemic, we can only believe that there is going to be larger impact for individuals on the spectrum in terms of employment. They are typically the first to be let go and the last to be invited back or be hired. And during the last recession, a lot of these phenomena was actually observed. So in this particular time that we have this pandemic, we don't really have the exact data yet, but from previous data during recession, this is telling us that we really need to be proactive. Otherwise, this group of individuals would suffer a lot. And one other thing that we are also wanting to note is that a lot of the specialized employment program for autism are really initiated and by big companies. And so such as like SAP or Microsoft or JP Morgan Chase or DXC Technology or Ernst & Young, those companies are doing really good work. And but then the collective sum that they have really helped are really still so much not adequate. The reason why I say that is that even the best examples, such as the companies that I told you about, they hire about a couple hundred people on the spectrum, and that's the really best case already. And when you group them all together, say it may be like 1,000 people, and that's all around the world. in the United States alone, there are millions of people on the spectrum. And if we talk about the entire world, there are like many, many more in many multiples. So we are really having a lot of trouble to move the needle just by thinking about the large companies doing all the work. And especially when we are thinking about the general population in the United States, it may be a different number than Ireland, but 80% of the workforce in our country are really working for the small to medium-sized businesses. So that means if we are only relying on the large companies to help hire people on the spectrum, that's probably not going to really solve the problem. And the other problem that we know is that the large companies tend to really use this opportunity as a talent acquisition strategy. They want the cream of the crop. They want the top 1% of the people. So this is helping a little bit for the group that really get the job, but that means that this strategy will not really work for most of the people with autism. So that's why we need to think about strategies that can help with the neurodiverse individuals getting jobs in small companies, small businesses, etc. So the approaches that we have taken to combat employment issues are listed here. So the first, we were actually running a lot of the steps in our Neurodiversity at Work program through in-person interactions, but after pandemic started, we basically moved everything to remote interaction, and it seems like it's been working. And the second active strategy is a few of us have started this consortium called Stanford Neurodiversity Project Consortium on autism employment during and after the pandemic. It's called SNP-KDAP. So basically, we now have 30 members. We want to say thought leaders in this particular area who are, I'll show you the slide here, that there are people that are coming all around California, and also some on the East Coast in New York, Washington, and Raleigh, North Carolina. And all these people are thought leaders because they have they are either CEOs of their company that hire people on the spectrum, like Rajesh Ananda. He's the CEO of Ultranox. Basically, the entire company is run remotely, and 75% of the company are composed of people on the spectrum. So, and there are also other people that are in the position of kind of moving resources, such as the directors of the regional centers in California. The neurodiverse individuals, especially for those that are more severely impacted, they are supported by these organizations called regional centers. And there are 21 regional centers in the state. We are fortunate to have 3 of those executive directors of these regional centers to be part of our consortium. So, and we also have other people that have a lot of experience in the state legislature. One of us was a senior advisor to the California Senate for 15 years. We also have a former Secretary of Labor of the state of California in our group as well. So basically what we were trying to do is to gathered together. We have this consortium for almost 3 months now, and we are trying to really document exactly how the pandemic is causing problems to the neurodiverse population. And by now, basically, we have a survey that we just designed, and we are going to be trying to get some data out of it in the near future. So the next thing is we have this design thinking workshop. So so today, actually, in just about an hour and change, I'm going to start this workshop series. Basically, is designed is kind of retrofitted from the design thinking course that I have taught for a couple of years. Basically, it is using design thinking approach to solve problems in neurodiversity related matters. And for this particular workshop, we are focusing on developing potentially processes or even toolkits that can be helpful in solving particular problems related to employment during the pandemic and maybe after the pandemic. And basically, for those that are not familiar with design thinking approach, is a 5-step iterative approach. And the first is to empathize, basically to really understand the user's experience. In this case, we have people that are, so in the workshop, we actually got about 100 people signed up, and about 15 of them are on the spectrum, and about 25 of them are parents of these individuals on the spectrum. And we have about 30 employment specialists. We have some mental health providers, as well as some educators. So basically, this is kind of like a novel multi-stakeholder approach, putting the people together. And the first step, empathize, is really to understand all the positions of all the pain points, or what's not working for all the stakeholders. We want to know a lot about the neurodiverse individuals, but as I showed you, the ecosystem that affect the outcome for these neurodiverse individuals, it's not only including neurodiverse individuals. There are many people that are affected. So basically, we need to know exactly how this employment process is. They are interested in doing something about, how they are able to, or what they are seeing in this process, and what also they think they need in this very difficult time in the pandemic. And then basically, after all of that, sorting out everyone's positions, then we would, in each group, so basically we have 100 people, we're going to have 10 groups. Each group will have about 10 people, and they would help each other to define exactly what the problem that they want to focus on. And then after that, they're going to need to go to the ideate step. That means they, after they have the topic that they have defined, they need to find solutions. So they need to create a lot of ideas. And the design thinking approach is one that welcome as many ideas as possible. And then after that, you sort them out, and you figure out like what's feasible and what's not feasible. We have 6 weeks for this workshop. So they're supposed to have ideas that are that can be implemented within this 6-week time frame. And after that, they would pick one best idea and build a prototype after out of it. And after that, basically, they would tell us about their prototype, and they would actually build out more if possible, and then they would have to test it. And a lot of what we are believing is that the outreach activities would be very important for them to focus on, because as I said, there's 80% of the people in this country working in small businesses, and they don't really know about these neurodiversity at work initiative, these specialized initiatives, and they don't usually hire people on the spectrum. So if we are able to create something that's going to help them, that would be really wonderful, or be able to attract these businesses to participate in this neurodiversity at work initiative. And the workshop participants would then come back to the group and present their findings. So basically, between workshop 5 and 6, they would do some field work, and they would report back in 2 weeks on September 18th. And this is leading into our summit, which is in October. So for the people that are in the workshop, we have decided that the top 3 groups, we are going to vote among ourselves, and the top 3 groups are going to be having the opportunity to present in our summit in October. So this is a summit that that was postponed from March. We were going to have an in-person summit. We had 400 people already registered and 200 people on the wait list, and they were not able to come because of the pandemic. And we decided to make this conference virtual. So our theme stayed the same, scaling up the Neurodiversity at Work initiative. And if you are interested in knowing more about our program, please visit our website. So for the last 30 seconds, I'm just going to summarize and say, during this pandemic, we are all affected so much, but definitely there are ways for us to be handling all the stresses, the anxiety that we have. It is normal to have a little bit higher anxiety because of what's happening, but to cope with it, we need to think about all different strategies for the children and for the adults. And there's really no one size fits all. Everyone will have to figure out like what may be the best strategy that would be working for them. And someone that says this is the way to solve the problem for you, that may not be the case sometimes. So parents would have to help decide for their children. Adults would have to decide it for themselves. With that, I'm going to stop and invite any questions that you may have.
Thank you very much. Thank you very much, Laurence. The workshop and the way you've laid it out is just amazingly organized in a stepwise fashion, and you know, sort of would be very good for all workshops to follow that program. It's interesting, it overlaps with the same dates of the virtual Academy of Child and Adolescent Psychiatry that was meant to be in San Francisco. And I wonder whether there would be an opportunity to link with some of the leaders and try and have your final presentation as part of that. It would be really celebratory. I wanted to ask a question just to kick off by way of clinical assessments during COVID and the restrictions, some based on face-to-face, and we've heard from some other research that actually telepsychiatry, that there is evidence that it can be as effective in assisting with assessment of young children and adolescents with autism or Asperger's. But one of the difficulties I have as a clinician with all clinical groups is trying to get that objective additional support from teachers, because they haven't been as available to either complete forms or contribute to assessments. So are you aware whether assessments for neurodiversity have changed, and whether they've reduced, or whether teachers and, you know, in the adult community, maybe occupational reports have continued to come in, or have they also been limited?
So I think that there are a few different parts of the response that I would want to give. One thing is, so in terms of assessments, previously in the US, it is quite common for us to rely on ADOS and ADI. And ADOS is, I think for this audience, you know what it is. It's a structured interview. I mean, structured interaction with the child. Yeah. And previously it has to be in person. So what we are noticing now is that there is some support, some data that seem to be suggesting that if we are not able to do ADOS, we may be able to use to do CARS, the Childhood Autism Rating Scale, and even through Zoom. That's been done by a lot of providers. And we were talking with John Constantino in Washington University, and their group has started using that, and then our group is now using that strategy as well. And the ADI, because it's a structured interview, you can actually do it through Zoom with the parents. It's not affected that much. In the past, we actually did that even before the pandemic. From the teachers, because the last few months, there's basically lockdown and the school was closed for a lot of students. They go back to summer school, but the summer school is only like a couple hours a day max, sometimes even less. So the feedback from the teacher is really difficult to really gauge if it's even relevant, because they have so little face time with the students. So I think in the upcoming quarter, I mean term, when the fall term starts, and in the United States, basically, I think most of the states, especially in California, most likely is going to be all remote for at least the fall. The teachers would have to do the regular amount of hours, not like before, like not like the transition time in June or end of May. At that time, basically, all the teachers don't know what to do, so they just give, if they are really savvy already, they can start using Zoom to teach. But now they all have to teach through Zoom. Right. So when all of them are teaching, then I think we are going to know a lot more about the children through the teachers. It's going to be very different kind of information, especially for the ones that are in special ed classroom. Right now, what I can say is that I was in another panel the other day, and that is done by a lot, mainly people from the School of Education, and they they are really saying that for the most part, the um, the, the special ed classrooms are not ready. They
Right.
are they are even more behind than most other teachers.
Mm.
So in order for them, and I would assume that a lot of the students, patients that we serve are going to be in special ed classroom, and really it relies a lot on the parents. Because a lot of the students are not able to go back to school just yet.
Right. Lawrence, by way of the neurodiversity workshops, one of our colleagues, Tom Flanagan, has asked whether if you could give some idea of some of the outcomes, if you've run them before with different groups. He would be intrigued to hear about a little bit more detail on that.
Hmm. Yeah, so in the past, we're running it with our students, so at Stanford. So basically, their backgrounds are different in that they have all different majors. They can be from business school, or uh, we had medical students, and we had computer science undergrads and so forth. And previously, we oftentimes have attracted like one half of the students as more neurodiverse, and the other half more like um, either siblings or close relative or close friend of someone with differences. So, so my previous experience is really more with the diversity among the student group. And this time around is my first time to run this workshop that have this multi-stakeholder
Okay.
approach. So I am very, very much excited about this, starting this. We just created a survey. We want to see if this workshop will be able to change any attitudes in any of these stakeholder groups.
Mm.
At least in the United States, it is quite common to see a division between what the parents view and what the neurodiverse adults view.
Right.
And usually we don't have the employment specialists in the midst to talk about all of these things. So this will be a learning experience for us.
So we'll watch that space by way of outputs. Can I bring in my colleague, Timothy Frawley, maybe, who's an interesting question and comment to make? Timothy, you're mute, Timmy. Yeah.
Super, super. Thank you very much, Fiona. And indeed, thank you so much, Laurence, for an excellent talk. I really appreciated your focus on work, in fact, in the presentation, and you had a number of slides which I'll be able to follow up on. My main interest in this area is how we can support neurodiverse individuals to succeed in that transition either to college or indeed to the workplace, perhaps from the perspective of employers, HR professionals, and secondly, clinicians who may be supporting people. Thank
Mhm.
you.
Yeah, thank you for your question. So we have a very elaborate approach to that, and basically we for the students we have this neurodiverse student support program, and basically it's a really comprehensive program that help students with uh, many different facets like independent living skills and learning differences and accommodations. But we also focus on getting internship positions. We believe that they would do a much better job if they actually have the work experience during college. So this is also the time that we can help the employers understand their differences, and also at the same time help the students themselves during their first jobs during college, even before their graduation. So we would teach them soft skills and so forth. And we would talk with the employers, teach them about what they may be expecting. And after they have started working with them, they would, the employers would be also be supported by us. We talk to them about their challenges and so forth. So so for the people that are not coming from our program at Stanford, we also help with neurodiverse individuals to get their jobs at in other companies, and for them we also teach the employer about how they can make changes in their interview, how they interview. We want to make sure that there are accommodations during the interview and also after onboarding.
Do you think, Lawrence, you'll get to a position where some companies, you know, the student will have some college work experience, but when they then qualify, that some companies, you know, might have kind of taken on board supportive work placements, so that some students who might otherwise struggle a little bit more with, you know, getting into the routine and the structure, you know, that there might be a little bit of a stepping stone from college to their first job?
Yeah, can you rephrase the question a little bit?
Whether some companies in the Bay Area might kind of set themselves out as leaders that will promote supportive employment positions for some students in the first year. Like, the first job is often the most difficult, and you know, it's kind of you take a chance because the person's CV may not be as good as their abilities. If the exam at the end wasn't quite the best for their abilities. Now, hoping that the exam will also change, and so the caliber of the student, you know, will be easier to see. But where some companies might, you know, offer supportive employment for that first crucial year.
So what we are encouraging companies to consider is internship positions. So basically, they have less. It is costing less for them. In some cases, actually, in the state of California, there's something called paid internship program. They basically the state can pay up to $10,400 for a training experience in the company, and so basically the employer will not need to pay anything.
Right.
And those are some strategies that we are trying to use to get some of the neurodiverse individuals jobs, because the employer has really very little to lose. They basically just need to be more open-minded, and they allow the neurodiverse individual to have the opportunity, and they don't really have to pay, and they don't need to keep them either after a few months. So, but then if the neurodiverse individual is really showing that he or she is valuable in the organization, then that person will have a chance to actually stay. So this is one strategy that we are taking, and some big companies are willing to even consider their paying themselves for the internship positions.
I guess it would be very important, and I'll end with this comment, to monitor that, to make sure that companies didn't kind of take advantage of that, where, you know, they don't have to pay, they get an intern for the summer. The intern actually does a lot of very useful work, but there isn't an offer. We had our own job bridge scheme in Ireland. I don't know if it's still running. And anecdotally, from having, you know, heard the stories of some people, they worked very hard, but they didn't get the offer of the job at the end of the placement. So it would be very important to make sure that actually companies had some additional motivation to want to do this. as opposed to just get cheap labor and get work done.
Yeah, absolutely. But in this environment, I would say even if they don't get the full-time job after that, at least they have a little bit more on their resume.
Yes.
So
yeah.
it's better to have something than nothing in this difficult time.
Yeah. Laurence, we're uncharacteristic to me. We're very good at timekeeping on this Zoom because we used to have it at lunchtime when we were aware that people had busy clinics to get back to. I guess the issue now is it's in August and it's unusual in Ireland. I don't know what it's like in Dublin, Lorna, but the sun here is very tempting to get back out to on a Friday afternoon. And knowing how busy all the clinicians are that are logging on and the importance of making sure we all look after ourselves. I'm not going to delay further, although I'm sure we would love to chat with you some more. And hopefully, Laurence, we will have another seminar in due course, maybe in November. We're thinking of running an event. Could I just thank all of you for tuning in today? I want to thank Laurence most sincerely for getting up, although I know it wasn't any earlier than usual, but just prioritizing us this Friday morning in California. To thank Beth and Tom and Timothy for their contributions. Many of you who work with other children and adults with neurodiversity, I can see some of your names and pictures. Thanks for tuning in and continuing that work. Can I just advertise our next seminar? Many of you will know Professor Santosh from the UK, the Institute of Psychiatry, and his talk is going to be going electronic in the time of COVID. So please do join us for that. And thank you once again.
Thank you.